When we think of ancient medicine, we imagine herbs, superstition, and guesswork. Primitive healers, crude tools, and blind faith. But what if that image is wrong? What if ancient doctors performed surgery so advanced they still astonish modern scientists today? For centuries, historians believe true medicine began in modern times. With microscopes, with anesthesia, with sterilization. Ancient treatments were dismissed as trial and error. But buried texts, preserved skulls, and surgical instruments tell a very different story. A story of precision, observation, and surprisingly deep anatomical knowledge. Over 4,000 years ago, Egyptian physicians documented diseases, injuries, and treatments in detailed medical papyri. The Edwin Smith Papyrus describes trauma surgery step by step. Diagnosis, prognosis, treatment. They understood organs, blood vessels, even the brain. This wasn't magic. It was structured medical science. One of the most shocking discoveries in ancient medicine is trepanation, a surgical procedure where a hole was drilled into the skull. This was done over 7,000 years ago. Even more shocking? Many patients survived. Bone regrowth around the holes proves these surgeries weren't fatal. They were intentional, and often successful. In ancient India, surgeons performed complex reconstructive procedures, including nose reconstruction. Using skin grafts from the forehead, doctors rebuilt noses lost to injury or punishment. This technique is still used today, nearly unchanged. Ancient Indian surgeon Sushruta described over 300 surgical procedures, and more than 120 surgical instruments. Ancient Greek physicians revolutionized medicine by rejecting superstition. Hippocrates argued disease had natural causes, not divine punishment. Doctors observed symptoms, recorded outcomes, and adjusted treatments. This shift laid the foundation for evidence-based medicine, a method still used today. Roman doctors became masters of battlefield surgery. They developed surgical kits, used forceps, scalpels, and catheters, and emphasized cleanliness. Roman military hospitals treated thousands of wounded soldiers efficiently. Speed and survival mattered. This pressure drove medical innovation forward. Ancient surgeons didn't operate without pain relief. They used opium, mandrake, alcohol. Some cultures even combined drugs to induce unconsciousness. Crude by modern standards, but effective enough to perform long surgeries. So why did this advanced medical knowledge disappear? Empires collapsed. Libraries burned. Knowledge stopped being shared. Centuries of medical understanding were lost, only to be rediscovered much later. Progress isn't always a straight line. Ancient doctors didn't have modern technology, but they had something powerful: observation, experimentation, and patience. Their success reminds us that intelligence didn't begin in the modern age. Some of the greatest medical breakthroughs were carved in stone, papyrus, and bone.